Hello, my name is Dr. Mlola Salako. I'm a consultant clinical oncologist, and today we'll be talking about breast health. We all know your breasts deserve tender, loving care. But how well do you know your breasts? Building a relationship with your breast starts with understanding what's normal for you. Today we are discussing breast health TLC, and TLC stands for touch, you look, and you check. So the first step is getting familiar with your baseline. And this means knowing what's normal for you, knowing the look and feel of your breast throughout your cycle, whether it's your menstrual or ovulatory cycle. T stands for touch. Getting familiar with your breasts is the first step in any TLC routine. Normal breasts can vary in size, shape, and texture. Some women have lumps, some have bumps or tenderness at certain times of the month. A regular breast self-examination can help you detect any changes, and I'll share some tips with you. The first tip is palpation. While you are lying down or you're in the shower, use the pads of your fingers to feel for any lumps or changes in texture. The second tip is touch. Using your pads of your fingers, you apply some pressure on your breasts to feel for any lumps or changes in texture throughout your entire breast tissue. Don't forget, you have to check your armpit area also. And the third tip is for you to actually look. So while you're in the shower or you're standing in front of a mirror, you must look for any changes in the appearance of your breasts, such as a recent change in the shape of your breast or a recent change in the size of your breast. Remember that it is normal for women to have one breast bigger than the other or smaller than the other. And so we get worried if this change in size or shape of your breast is recent. Another thing you should look out for is dimpling of the skin, and that's when the breast skin appears like the peel of an orange fruit with tiny holes. The third thing you should look out for is nipple retraction, especially if this is a recent occurrence. Remember, some people have their nipples pointing outward. Nipple retraction is when there's a recent pulling in of the nipple. If you're a woman that has her nipples pointing outward and all of a sudden it's pulled inwards, then that's a cause for concern and you should report that to your doctor. Or if there's nipple discharge, which may be clear, which may be milky, brownish, or bloody in nature. We are most concerned when it's brownish or it's bloody. Regardless, if you have a nipple discharge and you are not breastfeeding, then you should report that nipple discharge to your doctor. Another thing you should look out for is redness or irritation of the breast skin. For example, if there's like an eczema or a rash on the breast skin or around the dark area of the breast, then you should also report that to your doctor. Remember, your breast screening guidelines, what are they? There are 3 things I want you to remember. First, your breast self-examination starts from age 20, and this should be done every month. The second guideline is a clinical breast examination is when a doctor or a nurse checks your breast, and this should start when you are age 25 and should be done every 1 to 3 years. The third is a mammogram, which is a picture x-ray of the breast. And this is done from age 40 years old and can be done every year. So I'd like you to talk to your doctor about when to start your mammogram and how often you should have them. Early detection is key in the fight against breast cancer. If you have a family history of breast cancer, say 3 or 4 people have had breast cancer, ovarian cancer, it's important to talk to your doctor about your family history. Book a consultation because there are certain steps you have to take and there are certain tests that need to be done. For some of the breast cancer screening guidelines I mentioned earlier, you may have to do them earlier than the recommended age. Regular screenings are still crucial, especially as you age. Don't ignore any changes that concern you. If you notice a lump, nipple discharge, or any other changes within your breast, schedule an appointment with your doctor right away. Building a relationship with your breast empowers you to take charge of your breast health. By knowing what's normal for you, you can detect changes early and advocate for your well-being. Take control, get informed, and stay breast healthy.